contrary or something that concerns symptoms?
No, it's in pre-eclampsia in pregnancy. Pre-eclampsia is actually a syndrome. You know, there's a disease, there is a syndrome. A disease is when something just happened. That one is a disease. But when two diseases usually come together, two or more diseases come together, I don't know if you understand, it forms what? A syndrome. So pre-eclampsia is not actually a disease. It can be seen as what? A syndrome. Because two or more things has to be present before you pronounce somebody to have pre-eclampsia. Pre-eclampsia is just when you have severe hypertension in pregnancy. I don't know if you understand. Now, if that person already have hypertension before he got pregnant, then there is going to be a change in that hypertension. So if somebody's BP has been consistently 140/90 before she took in, for you to say that that person have pre-eclampsia, the blood pressure must have increased more than 20 millimeter mercury. So it must have gone from 140 to like 160. Is it clear? Now, there is going to be hypertension, then there is going to be protein in the urine. These two things is what is important to give you pre-eclampsia. As I said, it is a syndrome, not actually a disease. So, protein in the urine is a disease. Oh. Hypertension is a disease. Then when the two of them comes, that is two diseases that will now give us that syndrome, pre-eclampsia. Now, it is pre means that before. Pre means before. Just the same way we have pre-nursery. After pre-nursery, you will now go to nursery. So pre-eclampsia simply means that this is the stage you will reach before you now go to eclampsia. I don't know if you understand. So the name pre means that if you don't manage this thing well, this patient will go to eclampsia. So when we talk about eclampsia, eclampsia is now pre-eclampsia that now have seizure. If there is now seizure, then the pre-eclampsia has become eclampsia. So pre-eclampsia is actually eclampsia which has not developed to have seizure. So once the patient starts having seizure, it is no longer pre-eclampsia. It is now what? Eclampsia. Is it clear? So that is one of the complications in pregnancy. So that is one thing we look out when somebody comes and say, my legs are swollen. Since legs are swollen can also be part of pre-eclampsia. Once the legs are swollen, you must make sure that you recheck the blood pressure. You also make sure that you check the urine